Corona's sitting on the table or a doorknob, or you go to the gas station, you pump it. Now you touch it and Corona's now on your fingers. You still cannot get Corona. It doesn't go through the skin. The only way you're going to get Corona is now that it's sitting on your finger, if you don't wash your hands or Purell, is if you pick your nose, touch your eye, eat a sandwich, and the Corona is like, we got entry. It has to get from your finger or the table into your face, which is why the CDC and the World Health Organization and other organizations are telling people, wash your hands. And
20 seconds.
20 seconds.
With warm water and soap.
And don't touch your face. So if you have to scratch your nose, go like this. Don't shake people's hand, because if they have it, the likelihood of it getting near your face is closer. And if you avoid touching your face, the incidence and infectivity rate drops probably better than anything else you could do.
Hey, Dr. Bill here. This is going to be a killer. Well, maybe not. Meet the mentor. Not only are we going to interview Dr. Jeremy Fine, who's been my doctor for a long, long time, but we're also going to give you an update on the coronavirus with a lot of new statistics that are out, and with a great medical professional. Oh, I'm not allowed to touch people here to talk about it. So let's get to it. Dr. Jeremy Fine is a native of Johannesburg, South Africa. He grew up in Los Angeles, though. He completed medical training in internal medicine at Cedars Sinai Medical Center in 2004. He was then selected to be chief resident. He's also a former clinical instructor at both UCLA and USC schools of medicine. He was chosen by Los Angeles Magazine as one of the best doctors in Los Angeles for his exemplary skills and innovative approach to medicine. He also has been selected as one of California's favorite physicians, and mine too, in 2010, and was voted the most compassionate doctor. Dr. Fine loves to travel and has practiced medicine and lectured in cities across the globe, including Oslo, Norway, Sydney, Australia, Japan, Tel Aviv, Israel, and he is a proud father of 3 boys and married to a beautiful woman named Sharon. And Jeremy, thank you for being here.
Pleasure to be here. Thank you for having me.
So before we get to the whole Corona update and all that, I really want to just spend a little bit of time talking about your career as a doctor, okay?
Sure. So first of all, thank you for having me. You know, medicine is a marathon career and starts earlier in life for some people and later in life for others. But I think the important thing to remember about a career in medicine or health, or quite frankly, anything you want to do, is find something that you're interested in and then hone in on it and work towards that inch by inch. People sometimes think you have to do a million things at once, all at once, which you don't. The goal of life in general, career in general, for me it was medicine or healthcare, is to enjoy what you're doing and through your life experiences continue to hone in on the things you like.
But why medicine? Like what
so I don't know.
You to be
I mean,
doctor?
good question. I always liked biology growing up. I would always learn about biology in elementary school. And before I went to med school, I was actually going to become a vet because I love animals. So, and I like biology. And then I realized I didn't want to deliver baby calves and stick my hand up, and grab a calf out. So I was like, okay, well, veterinary school is not for me, but I actually didn't come out of the womb saying I want to be a doctor. And I was going to become a vet. And then after that, I was going to become a botanist. I studied plant biology at UCLA, and that didn't work out for various reasons. And so ultimately I knew I liked medicine. I knew I liked science. I knew I liked people. I wanted to help people. And this is where the road took me. My advice would be, don't paint yourself into a corner to say, I have to do A, have to do B, have to do C. Let your life take you and your interests take you where it does, and you may be surprised ultimately where you end up. For me, it was a very sort of long, gradual process that ultimately coalesced to a career in medicine, but it could have easily been something else.
But if I have a young student out there watching us right now, and they really are interested in becoming a physician. What advice would you give them? What kinds of classes should they take? And is there anything else that you think would be pertinent for them to really focus on at this point in their life?
Yeah, I mean, I think at this point, the important thing is to get exposure. So take a class in biology and chemistry. A lot of the things that happen in medicine on the way to get to medicine can be a little bit of a filter. So if you hate chemistry, it doesn't mean you can't be a doctor. Just deal with chemistry and organic chemistry, physics. Just do it because it's a means to an end. But don't get scared that if you can't get through chemistry, you're not going to be a doctor. That's insane, because a lot of people, especially in the first year of college, take all these big classes and get totally spooked out. If you really have your mindset on something, you'll figure out a way to get through it. And chemistry and biology and organic chemistry and physics, I forgot everything and don't use it. Doesn't mean you don't have to take it.
True.
So don't get freaked out. Don't be that person who gets really scared about it. And then get exposure. Go to a doctor's office. Go to a dentist's office. Go to a hospital. Volunteer. Understand the realm of the career that you're going to get into, and there may be things that you ultimately didn't know about, which could either help steer you into that field or away from that field. Exposure, but most importantly, do fun stuff. The process is hard enough. Try to do stuff that's enjoyable on every level, and I think that ultimately will pay off and help guide you and steer you to where you ultimately end up.
Now, one thing before we go to the coronavirus update, you chose to practice medicine in a very unique and novel way, which I'd like to have you explain. One of the things that I really love about the medical profession is, as a dentist, I really honed in on cosmetic dentistry. You get to create the kind of practice you have. I have friends that have become pedodontists or endodontists or periodontists or whatever. But, Jeremy was in a very large group practice, kind of doing internal medicine like everybody did. And then he had, I'll use a Jewish word, the chutzpah to go out and do something different, which is a concierge kind of delivery system. And I'd like you to just spend a minute and talk about that and why you felt that would fit best with your style of delivering healthcare.
Sure. So my goal in going into medicine was to be able to take care of people and spend time with them and not feel disproportionately rushed to get in and out of a room to see a patient. The medical system sort of can go in any way you want, but there are many patients out there and perhaps fewer doctors. So my goal was to take really good care of patients and spend time with them. I transformed my practice into a practice whereby I have fewer patients and spend much more time with them. So I reduced the volume of patients I see so that the reason I went into medicine, which would be getting to know my patients, being able to do house calls, giving them my cell phone, getting to know them and their family and everything about them, could be fulfilled. So I reduced my practice. I have either individuals or families. I have some multi-generational, so I take care of the parents, the kids, and the grandkids. And so the sort of goal of what I went into medicine for has been fulfilled in the way that I've sort of reshaped my practice. And ultimately, I think the most fulfilling part about what I do is not only giving the medical care, but really getting entrenched and getting to know the families and becoming part of their family, which is, kind of a big rewarding aspect of the medicine, as in addition to, of course, dealing with the healthcare and the medical and the, heart disease and all the other things that are sort of traditionally associated with medical care.
Great. Thanks. All right, so let's talk about coronavirus. There's a lot of myths out there. There's a lot of false information. There's a big scare. And what we'd like to do is really give you facts right now so you can understand what's going on with this. I was just supposed to go to a huge conference with YPO down in San Diego. I should have been there this week. They had thousands and thousands of people flying in and coming, and they literally canceled it and gave everybody a refund. Is that a right choice? I don't know, but let's talk about this. So in the LA Times published yesterday that China's Center for Disease Control and Prevention has monitored 70,000 cases in China right now. 15% of the people infected with coronavirus in China, that have died, 15% are over 80 years old. Not only are they over 80 years old, they're also in poor health, and they also got care really late in the game. Overall, in all of China, with the 70,000 cases that they've monitored, they have a 2% mortality rate. And again, the 2% are typically in people who are over the age of 60 and also in poor health, right? So what is it? It's basically a respiratory illness. It originated in Hunan, China in 2019. How is it spread? It's spread by droplets, which they estimate travel up to 6 feet. The droplets will come from coughing or sneezing or a handshake or a doorknob or something like that. And then the way it's introduced into your body is you either inhale it or you touch a doorknob and then you touch your eye or your nose or your mouth. And so you have to be cognizant of these things and take some precautions. Jeremy, anything?
Yeah, so that was well said. So coronavirus as a viral family is not new. People have been getting infected with coronavirus for decades. And what makes this particular coronavirus unique is that it's a little bit more resilient and hardy and tends to be a little bit more aggressive once you get it. So we've all had a cough, a cold, and if we had swabbed everyone every time we had a cough or cold, coronavirus would have come up. This just happens to be a more aggressive. The mortality rate, as Dr. Dorfman said, is with people who are older. Their statistics, 1.2 to 3.2%. But let's say an average of 2 to 3% mortality, which means if you get it, those are the 2 to 3 out of every 100 people who got it died. Those people are older, typically 70 to 80-year-olds, and who have what we call comorbid conditions. Not only are they 70 or 80, but they have asthma, they've been smokers, they have heart disease, diabetics. They're overall less healthy people. And so when a virus attacks somebody who's less healthy, just like it would if they had influenza or the flu, they would get more ill and could theoretically die. The numbers are likely even lower mortality than that because we haven't been testing everyone. There
Correct.
could be 5 times as many people in China with corona. We only are testing the people who are known or who are dying. So the likely statistic is actually lower. It could even be 1%. Because for every person we know has corona, in theory, there could be 5 more who have it and we don't know, and they're not telling you because they feel fine. So actually, I would guesstimate that the mortality rate, which is, again, the number of people per 100 that die who get corona, is actually lower than what they're reporting. Another important fact to remember is that a virus, if it's sitting on this table, you will not get coronavirus unless it goes from here into your mouth, your nose, or your eyes. So how does it get there? It doesn't fly into the face. So the only way to get coronavirus, or again, any virus like the flu or other, is if it gets into your nose, eyes, or mouth. So if somebody with corona is standing next to you and coughs in your face, you got corona. The chances of that happening, pretty zero, right? Somebody's coughing, they're going to go in their thing. So most people are going to get it in a secondary way. Corona's sitting on the table or a doorknob, or you go to the gas station, you pump it. Now you touch it and corona's now on your fingers. You still cannot get corona. It doesn't go through the skin. The only way you're going to get corona is now that it's sitting on your finger, if you don't wash your hands or Purell, is if you pick your nose, touch your eye, eat a sandwich, and the corona is like, we got entry. It has to get from your finger or the table into your face, which is why the CDC and the World Health Organization and other organizations are telling people, wash your hands. And
20 seconds.
20
with
seconds.
warm water and soap.
And don't touch your face. So if you have to scratch your nose, go like this. Don't shake people's hand, because if they have it, the likelihood of it getting near your face is closer. And if you avoid touching your face, the incidence and infectivity rate drops probably better than anything else you could do. Wearing a mask is good for people who have symptoms. So if somebody has corona, again, or the flu, and coughs, if they have a mask, the cough is not going to go in the air and hang out for 6, whatever the statistics are, it's going to go in your mask. But if you don't have corona or don't feel bad and you're just wearing a mask, it's not going to do that much.
I have some statistics I also want to share too that's really important. According to the County Department of Public Health, the risk right now in the United States and in Los Angeles is considered very low, okay? This is also much, much more mild than SARS was or MERS, okay? MERS killed 33% of people untreated, SARS 10%, and right now the estimate on corona is about 3% worldwide. But again, as Dr. Fine said, these are people with already compromised medical conditions. So the chances of a young, healthy person contracting this and dying from it are very, very, very slim.
Yes. So to put it all in context, I think the most important thing is panic drives hysteria, and there are preventative measures being taken. So, for example, you've seen on the news, or presumably seen on the news, that they're closing schools. Why are they closing schools if one person or no people have it, but a relative of somebody? Children under 11 are typically asymptomatic. They don't even know they have it, but they are called vectors, which means that they carry it. Your kid goes to daycare, your kid goes in whatever, second grade, doesn't know he has corona, but the friend has it, gives it to him because they're all sharing toys and slobbering all over everything, bring it home, and then the kids bring it to the parents and the grandparents. The goal of the school closures is not because there's a widespread panic that everyone in the school is going to get ill from corona, but rather it contains the spread and infectivity for those kids to take it home to the community.
Exactly.
So it's a preventative measure so that they don't get other people sick. And what Dr. Dorfman said is, globally, the statistics are exceptionally low, but not zero. So you have to be smart about it, understand the mechanics of how a virus gets you sick, which is, again, what we said. It has to get into your nose, mouth, or eyes. And if you understand the mechanics of it, you will do things to prevent that from happening, like hand washing, keeping your hands away from your face, and staying away from people who are sick, which is why they're saying, if you're sick, stay home. It sounds pretty intuitive, but a lot of people who are sick just go to work anyway and kind of struggle through it. This would be the time for even those people to kind of hang out at home.
I think the most important point that both Dr. Fine and I are trying to make is just be smart. Be careful. Wash your hands. Practice good hygiene. Make sure that if you do cough or sneeze, whatever, you cover your cough, and try and avoid putting yourself in a situation where you can get infected. Don't touch your eyes, your ears. Well, actually, that's another one. A lot of people were concerned about whether they can get it through their ears.
I don't think you can, because the ears are a closed circuit. If there's an eardrum in there and nothing gets past it. So I'd have to double check, but I would say the answer is no.
It's mainly eyes, nose, and mouth. So, make sure you wash your hands, use warm water and soap for a good 20 seconds. Make sure you can use an alcohol-based hand disinfectant, which I hear are pretty much like out of stock in every store you're going to now. But just be smart about it, and you should be fine. And again, if you do know of somebody who's ill, stay away from them. Especially keep them away from elderly people, and especially elderly people that have other complicating medical factors.
Yep, well said.
Dr. Bill, over and out.